Bronchiolitis is almost always caused by a virus, with RSV being the most common virus. It is a very contagious virus. Sometimes children with bronchiolitis have trouble breathing, stop breathing, and can have low oxygen levels. Welcome back. Today we are talking about RSV, which commonly causes bronchiolitis. RSV is short for the Respiratory Syncytial Virus. It causes the common cold symptoms, including cough, congestion, fever, runny nose, and headache. It is widespread. Some studies state that everyone has had RSV by the time they are 2 years old.
How do you get RSV?
It is a very contagious virus. You can get the virus by breathing it in after an infected person coughs or sneezes. You can also have direct contact with the virus by kissing someone who is infected or touching a surface that has the virus and then touching your face. Hand washing is very helpful to prevent getting the virus.
If everyone gets RSV, why should we worry about it?
Well, we especially worry about RSV in infants less than 6 months old, people with underlying medical conditions including prematurity, lung or heart issues, and then also in older adults. RSV is the most common cause of pneumonia and bronchiolitis in children less than 1 year old. Most people that get RSV will heal on their own, but sometimes people have to be hospitalized for supportive care, including oxygen and IV fluids.
To recap, RSV is very contagious and very common. Most will do okay, but some can get really sick, especially infants, older adults, and people with underlying medical problems. So what is bronchiolitis?
Bronchiolitis is the infection of these small airways of the lung, called the bronchioles. When we think about the airway, we divide it into two parts: the upper airway, including the windpipe and voice box, and the lower airway, including the lung. Bronchiolitis is an infection of the lower airway. It is a very common lung infection in infants and young children. So much so, it is actually the #1 cause of all lower respiratory tract infections in children younger than 2 years old. We see a lot of bronchiolitis in the United States during the winter and spring months.
Let's break down how RSV causes bronchiolitis.
Bronchiolitis is almost always caused by a virus, with RSV being the most common virus. To break this down, you first contract RSV. The virus then causes irritation, swelling, and mucus to build up in the small airways called the bronchioles. This is termed bronchiolitis. Sometimes the irritation of these small airways can cause wheezing. Wheezing is often described as a noisy, whistling breathing, especially when you exhale or blow air out.
How is bronchiolitis diagnosed?
Usually by physical exam. You can also obtain a viral respiratory panel that tests for many viruses. Chest x-rays are usually not helpful in diagnosing bronchiolitis, but they can look for other things, such as bacterial pneumonia or a foreign body if needed.
How is bronchiolitis treated?
Supportive care. Suctioning the nose and upper airway is very important. Helping your child get the secretions out can help them breathe better. A humidifier can also help. Keeping your child well hydrated is key. Any way you can help your child to drink fluids is encouraged. Drinking diluted sports drinks or electrolyte solutions, using a dropper, or eating a popsicle can help. We usually do not give antibiotics or breathing treatments for bronchiolitis. Some children can get very sick from bronchiolitis and require hospitalization. Sometimes children with bronchiolitis have trouble breathing, stop breathing, and can have low oxygen levels.
Recap, bronchiolitis is caused by a virus and diagnosed by physical exam. Antibiotics are usually not necessary. The initial treatment is supportive care, including suctioning and hydration. However, some children can get very sick. What should parents look out for?
You should always discuss this with your doctor. If your child is sucking in their neck, chest, or belly to help them breathe, is too out of breath to talk or walk, has blue lips, is drooling or having difficulty swallowing, is very sleepy and hard to wake up, has noisy breathing, or any other worsening symptoms, that can be concerning. In young infants, sometimes lethargy, nasal flaring, and grunting are also concerning. And that sums up our talk on RSV and bronchiolitis. Remember, none of this information should override or replace the recommendations of your doctor. We are not personally taking care of you or evaluating you. If you are concerned about an emergency or a serious medical condition, please call 911. Keep tuning in for more information about common medical conditions. And don't forget to like and subscribe if you find this content helpful.